Hi, I'm Daniela. I am the patient care coordinator at Potomac Medical Aesthetics, and I'm here with Dr. Petropoulos to talk about PRP for hair loss. Is this something that really works? I think there's a lot of men listening, wondering, is there something that I can do for hair loss? So, can you answer that question, Dr. Petropoulos?
I can. And that's a question that a lot of men have, and a lot of women too. Um, so I would tell you that the efficacy of PRP for hair depends on proper patient selection. So if I have a patient who has absolutely no hair, the typical male pattern baldness where they lost their hair in their 20s and you see nothing, that's not going to really do very much. If it were that easy, you wouldn't see anybody with any baldness. So it's not going to be the type of solution I would recommend for that type of hair loss. I think that the type of patients who are best served by PRP for hair loss are those who are having thinning hair, especially women, where using PRP can supplement the appearance. It can make some fuller growth. It's never going to create the type of beautiful waves of hair that people envision with these sort of therapies, but it certainly can supplement and hide some of the appearance of the thinning hair. There are some patients where still you would say, I think you're better off getting hair transplant surgery or something more aggressive. Those are the full baldness. But those who have thinning hair, both male and females, are often served very well by a series of 3 to 4 types of these treatments. And most importantly, taking a good history is very important, because if somebody has an undiagnosed thyroid condition or excessive testosterone levels, maybe there's a medical reason that we need to look for where the treatment may not work unless we treat the underlying medical condition.
So let's talk about what to expect during the treatment, because I'm sure there's a lot of posts on Instagram where you're seeing individuals actually microneedle PRP into the scalp, but then there's also actually injecting the PRP into the scalp. What do you think is more effective?
I think that the combination of both is the Rolls Royce treatment. Really, that if somebody said to me, what would you do to me if I'm a good candidate? I would do a combination of both. I think about 90% to 95% of people who do a lot of hair growth, including myself, believe that injecting is the primary driver of hair growth, because we're putting that PRP into the subcutaneous tissue in the scalp where the hair follicle is. So it's getting deeper and it's dispersing throughout the scalp. There is some evidence that microneedling with a PRP bath after the injection might give us a little bit of an improvement. So given the choice, I would take the injection if I had to choose one or the other. But if I want the best results, I would do the injection followed by the microneedling with the PRP bath.
And what's the timeline for these? Are these treatments, do you need multiple treatments? Is this a one-time thing? Like, what can a patient expect if they're wanting to see results? And what percentage range would you say can be expected for regrowth?
Great. So most patients will be best served by a series of 3 treatments every 4 to 6 weeks or so. And so what that involves is coming into the office and spending about 45 minutes of getting anesthetic onto the scalp area after we cleanse it. We also anesthetize the blood draw site just to give patient comfort. So we would draw 2 tubes of blood in FDA-approved tubes, where we would later go to the centrifuge with that blood, get to spin down the blood to get the platelet-rich plasma. We extract it from the tube, and after about 45 minutes of numbing, we clean off the anesthetic, and then about every centimeter in the areas that are thinning, we will inject 0.1 to 0.2 cc's of plasma using a chiller to really provide nice topical anesthetic. The injections take literally about 5 minutes. So we do that every 4 to 6 weeks for a series of 3 to get the best results. We should start seeing results somewhere around 2 to 3 months. The results typically last for a year to 2 before a new series of treatments should occur. And I would say somewhere on average between 30 to 60% is an average type of result of the improvement of both the density of hair that we see as well as some of the thickness of existing. So it creates both new hairs that tend to be a little bit thinner than existing hairs, but they can also thicken existing hairs. So you won't grow dark hair. So if you have gray hair, it will still come out gray typically. The hair growth is typically the type of color that you have in that area. And so over time, the effects of the PRP wear off. So that's why retreatment is necessary. More importantly, again, getting to an underlying medical diagnosis to try to get the best results is very important. But certainly, there are so many patterns in hair loss, genetics, exposure to androgens like testosterone, which accelerate hair loss and hair recession, where that continues to go on. So the PRP does not last forever. It's not a one-time series and for the rest of your life you're done. Typically, the results last for about a year or two, and then you do another series to continue to get the similar type of pattern of results.
Perfect. That sounds amazing. So, for any of the gentlemen out there or the ladies out there that are struggling with hair loss, if PRP injections or PRP with microneedling for hair loss sounds something that you'd like to explore more, we would love to invite you in for a complimentary consultation. We can examine you, find out if this is a good fit, and give you all the information that you need to make the choice that's best for you.
Thank you, Daniela.